اقفلها خالص. هنا البرزنتيشن بتاعتي موجودة بنفس السيكونس او بنفس الترتيب بتاع السلايدز اللي انا محضراه للمحاضرة بتاعتي. وانس ان انا بدأت عايزة ابدأ التسجيل بدوس تسجيل، بدء التسجيل من.
السلام عليكم ورحمة الله وبركاته، أبنائي وبناتي الطالبات في سنة رابعة. النهاردة هنتكلم عن the child health, actually infants and preschool children health related problems. At the beginning of our lecture, we ask ourselves some questions. What are the vulnerable groups, Why they are considered vulnerable? Who are the child? What are the common health-related problems of children? In our curriculum, we concerned as a public health for some groups in study as geriatric groups, mothers in the childbearing period, pregnant women, including pregnant women and the postmenopausal woman, and so on. Also, children throughout their life. So, who are the child? This is the period from birth till the age of 18. من أول ما بيتولد الطفل لغاية أما يوصل ثانوية عامة أقول عليه طفل. طيب هما ليه vulnerable? Why they are considered vulnerable? They are considered vulnerable for many reasons. For example, they undergo growth and development. Growth means increase in the size, and development increase in the cognitive function, especially in the first 5 years of life. So they need special care. Also, they are liable for infectious diseases specific for children as measles, mumps, rubella, etc. They need nutritional care, either exclusive breastfeeding in the first 2 years of life, and the first 6 months of life actually, and weaning in the later 2 years. Also, they undergo or they need special care in education, health, playing, lifestyle, and so on. So they are considered as vulnerable groups. What are the common health-related problems of children? It is difficult to discuss this topic in the 18 years as a whole, so we can divide this period into categories. Today we are concerned with the children in the first 5 years of life, or infants and preschool children. According to WHO and UNICEF 1993, the aim of child health is to ensure that every child, whenever possible, lives and grows up in a family unit with love and security, in healthy surroundings, receives adequate nourishment, health supervision, and efficient medical care, and taught the elements of healthy living. So, this is aim of safe child. These can be achieved through providing quality care to the infant since before birth and through the first 5 years of life. As I told you, we can divide child healthcare services into 3 main categories: infants in the first year of life, preschool children 1 year till 5 years, and school children more than 5 years. In our topic today, we will discuss health-related problems in the first 5 years of life. We can divide it into 2 main categories: morbidity problems and mortality problems. Regarding morbidity problems, the first important one is the communicable diseases, refers to infectious diseases runs in the community, or diseases which can be transmitted from person to person inside the community. First one is a congenital infection. They can be transmitted in utero or transplacental or from the mother to her baby during pregnancy. The best examples is toxoplasmosis, which is a parasitic disease, rubella, which is a bacterial disease, AIDS, viral disease, and so on. These infections may lead to either abortion or congenital malformation or congenital diseases. After birth, we have to divide the period into neonatal infections and post-neonatal infection. Neonatal infection, that say infections in or exposure to infection in the newborn period, which is the first month of life. The newborn infant has naturally acquired passive immunity, fortunately, from mothers against diseases to which a mother is already immune, as measles, poliomyelitis, diphtheria. But this is not true regarding TB. Why? You know that TB has a specific type of immunity which is called intracellular immune reaction. That says there must be a focus of infection in the body to produce antibodies. This explains why that the first vaccine given to infants shortly after birth is the BCG vaccine, because the baby has no immunity against tuberculosis acquired from his mother. As regards whooping cough, it is still under study whether antibodies from mother can be transmitted to her baby during pregnancy to protect him against whooping cough or not. Up till now, it's under study. The commonest neonatal infections are ophthalmia neonatorum, tetanus neonatorum, epidemic diarrhea, and streptococcal infection of skin and umbilical stump. This explains why we can prevent tetanus neonatorum by giving the mother during pregnancy or pregnancies 5 doses of tetanus toxoid to protect her baby against tetanus neonatorum. Regarding ophthalmia neonatorum can be prevented also by preparing the child uh, or the birth canal by giving the mother treatment to kill all the organism which may infect birth canal, especially if the baby will be born vaginally or normally. As a routine, all the children after birth given eye drops of antibiotic as a chemoprophylaxis from ophthalmia neonatorum. Also, streptococcal infection of skin and umbilical stump common to occur among neonatal infections, so mothers taught or learned how to take care of her baby or especially dealing with the umbilical stump. Post-neonatal infections, children less than 5 years suffer from 3 attacks of acute diarrhea and 5 episodes of acute respiratory tract infection every year. These infections either primarily or secondary to other diseases. The second problem is malnutrition. It is important to be sure that the children have good nourishment, because malnutrition can prevent the child, can produce a handicapped child, and good nutrition can prevent handicapping condition. For example, if there is a deficiency of calcium and vitamin D, this may result in rickets. Rickets, affection of the walking, sitting, teething, and may convert the child into handicapping one. This is for example. Moreover, malnutrition may affect cognitive function and may lead to mental retardation, which persists for adult life. The third problem is prematurity. What is the meaning of prematurity? Actually, there is many definitions, but the most accurate one is giving birth of baby or infant weighs less than 2,500 gram or less, or giving birth before 36 weeks of gestation. Some books defined it at low birth weight below 2,500 gram at birth irrespective to duration of gestation. So the question now, what is the normal duration of gestation? Usually it's about 40 weeks or 280 days plus minus 2 weeks. Let's say normally 38 weeks of gestation may be normal, and till 42 weeks of gestation may be normal. So below 38 weeks of gestation is abnormal. What is the hazards of prematurity or health hazards of prematurity, and how can we avoid this condition, and what are the predisposing factors which may lead to prematurity? Regarding predisposing factors, it can be divided into intrauterine infection, as we told you before, or maternal factors as low socioeconomic status, age below 20 years, height of the mother less than 150 centimeter, previous history of abortion or premature delivery, maternal smoking, alcohol or addiction, or drug addiction, because alcohol and the drug may lead to severe vasoconstriction of blood vessels in general, including placental blood vessels, which affect the nutrition supply of the baby. Associated diseases with pregnancy as anemia, cardiac diseases, urinary tract infection, bronchial asthma, and hypertension. Obstetric complication as preeclampsia and postpartum hemorrhage, premature rupture of membrane, and malpresentation. What is the meaning of premature rupture of membrane? Normally, there is a membrane surrounding the baby called amniotic sac. Inside the amniotic sac, there is the amniotic fluid. Normally, during labor, membrane ruptured. This may enhance normal vaginal delivery. Sometimes rupture of membrane occur early and is considered as premature rupture of membrane. And this may lead to early labor and delivery of a premature baby. Malpresentation. Normally the presenting part is the head or the cephalic part of the baby, with this cephalic part anterior and the face is posterior. This is the normal presentation. المقصود بالpresentation هو الجزء من البيبي presenting during labor. Any malpresentation, let's say shoulder presentation, arm presentation, leg or knee, umbilical cord presentation, is considered or are considered as malpresentation, make the condition or leading to prematurity. So what? What are the health hazards of prematurity? Premature baby liable for malnutrition. This is due to poor suckling, poor digestion, immature liver, may lead to rickets or anemia. Impaired regulation of body temperature, as the hypothalamus, which is a part of our body responsible for body temperature regulation, is immature, regarding leading to tendency to excessive heat loss. Hypothermia is fatal in this condition. Infection, especially gastrointestinal and respiratory tract infection, impaired mental development as a result of maybe Kernicterus increase the level of bilirubin, being the liver is immature, increase in the number of RBCs during pregnancy. That's a physiological polycythemia because RBCs are responsible for carrying oxygen and nutrition to the baby from his mother or her mother. After birth, no need for this large number of RBCs, destruction of RBCs occur. Liver is responsible for getting rid of the products of RBCs destruction, resulting in accumulation of bilirubin. If it is increased, it may lead to kernicterus, with mental retardation may occur later on. Hemorrhage may occur as an accident or as a birth injury. Mortality is high due to intracranial hemorrhage and pulmonary infection, where pulmonary complication also may occur in the form of respiratory distress syndrome as a result of lack of surfactant, which helps alveoli to expand and taking breath. So management in the form of establishment and maintenance of respiration, giving oxygen, prevention of infection via sterilization of air, dressing of umbilical cord and used sterile articles. This is a photo of a premature baby in the first few minutes of life for resuscitation. We can notice that the baby is wrapped in a plastic bag to avoid hypothermia. They try to give him an oxygen supply and a line for nutrition as a nutritional supplementation. Also, they can give him his vaccines and they can give any other lines of resuscitation, but we notice that they deal with the baby with their hands not covered. They may undergo sterilization of their hands, but it's better to use gloves. Let's say all maneuvers with the baby must be under sterile or in a clean condition. This is the photo of a normal baby. We can notice the difference in the color of skin, in the weight, the normal weight of a child about 3 to 3.5 kilogram. Also, the baby here is covered with white cheesy material, which is called the vernix caseosa. It's naturally insulating material to prevent hypothermia. Also, normal babies or normal infants undergo neonatal resuscitation to be sure that there is no congenital anomalies, to be sure that there is normal reflexes. They given their vaccines, and we can take a sample of blood from their heel to make hypo to be sure that there is no hypothyroidism as a screening for hypothyroidism, because treatment for hypothyroidism must be given as early as possible to avoid mental retardation associated with hypothyroidism later on. Let's say it is a form of secondary prevention, as you know, early case finding and proper control or proper management. Another problem is the post-maturity, or means post-term infant, is that infant born after 42 weeks of gestation. احنا اتفقنا انه النورمال duration of gestation 40 plus minus 2 weeks، يبقى اكتر من 42 اسبوع ده abnormal ويتقال عليه post mature. طب ايه مشكلته؟ It's dangerous to fetus because of placental insufficiency. So anoxia may occur and abnormal neurological signs in the newborn infant. The most common abnormal neurological signs is cerebral palsy and spastic diplegia. Its prevention mainly by proper antenatal and natal care. Also, prematurity can be prevented by proper antenatal and natal care. The next problem is accident. Accidents. Sometimes in the exam, a question column explain why. Children in the first 2 years of life are more prone to accidents. This can be explained by two reasons: the overactivity of young children and the curiosity or eagerness to explore surrounding environment. The accidents can be divided into indoor accidents or outdoor accidents, having a risk of this disability crippling among children. Now, another problem, which is a very important problem, is the handicapping children. What is the meaning of handicapping? Temporal and or permanent, physical and or mental disability affecting normal growth and development and social adjustment of the child, making him or her in need for special services in order to develop his or her best capacity. So, any condition, either temporal or permanent, make the child disabled and the need for special help is considered as handicapping condition. What are the factors which may lead to this condition? Maybe genetic factors, biological factors as age of parents, very old and very young mothers or fathers, a very short birth interval, the best optimum time as a birth interval is 3 years, birth order, and special habits as smoking and drug addiction of the mothers or parents. Antenatal factors, abnormalities of pregnancy are a major etiological factor of all types of handicapping conditions. The most important of them are prematurity and intrauterine hypoxia. Natal and neonatal factors as birth injuries, dislocation of hip or Erb's palsy or whatever, metabolic diseases as phenylketonuria, which is a metabolic disorder, also hypothyroidism or blood diseases as thalassemia. Also, childhood factors, as I told you before, nutritional deficiencies, infectious diseases as poliomyelitis, measles, TB, meningitis, encephalitis, and so on, drug intake, accidents, psychological trauma as economic deprivation, occurrence of vagaries including wars or political conflicts, divorce of parents, or maternal deprivation. Also, ignorance of the parents about the child rearing makes the child more prone to social maladjustment. Now, what are the types of handicap? Physical handicaps as visual, auditory, speech defect, crippled child, delicate child. Mental handicaps as morons, imbecile, idiots. Regarding visual handicaps condition, blind child who have no sight or whose sight less than 6/60 was with both eyes after correction. Uh, Partially sighted children, their vision is less than 6/24 with both eyes after correction. They are considered as visual handicap. Auditory handicaps, deaf children whose hearing is so defective that they require education by methods used with little or no speech. They usually have no speech, whether natural or acquired. Let's say a deaf mute. Speech defective handicaps, they may be physical in origin in need for ENT care, or social in origin in need for psychosocial care, Some of such children require special schooling. Now, what is the meaning of crippled children? What is the system in our body responsible for movement? In our body, the system responsible of movement, joints, bones, and the muscles. So any gross abnormalities or disabilities of muscles, bones, or joints leading to crippled children. The commonest cause cerebral palsy, muscular dystrophy, congenital deformity, rheumatic arthritis, limb deformity due to severe burns, poliomyelitis, or amputation are also causes of crippling. Delicate children, children with poor health status from chronic illness, making them physically impaired and need a change of their environment. This condition may be due to cardiac diseases, metabolic disorders as diabetes, epilepsy, and unpredictable loss of consciousness, special susceptibility to trauma as hemophilia or hemorrhagic disorders in general, intermittent prostrating disorders, example asthma, vertigo, migraine, and severe pain disorder. Now, regarding mental handicapping conditions, mental handicap is child with abnormal intelligence. How can we measure abnormal intelligence? Actually, by using what is called IQ or intelligent quotient, which is a معادلة with the numerator is the mental age and the denominator is the chronological age. The mental age can be measured by specific tests used for this condition. So it must not be below 100%. It may be above. Any decrease below 100% considered as mental handicapping condition. According to IQ, we can divide mental handicaps into three main types. The first one is the morons. Alhamdulillah, they constitute 75% of all mentally handicaps. Their IQ is mild subnormal from 50 to 70%. They are educable and trainable. They can, they are capable of receiving learning in specific schools or schools specific for them. They cannot learn in ordinary schools, but we can take care of them to prevent more deterioration of their IQ. Is the imbeciles. They constitute about 20% of all mental handicaps. Their IQ ranges between 20 to 49%. They are not educable but trainable. They can be trained to achieve some economic usefulness at home under supervision. They are capable of their own physical self-care. Idiots, their IQ below 20%, they constitute only about 5% of all mental handicaps. They are non-educable, non-trainable. They have minimal response to physical dangers, so they are in need for continuous care and medical treatment through their lives. What are the causes of mental handicapping? It may be antenatal factors as maternal exposure to radiation early in pregnancy, maternal infection in the first trimester, example by rubella, prematurity, toxic agents, ingestion of some drugs during pregnancy which may be a cause of congenital defects, endocrine factors. Natal factors as prolonged natal hypoxia resulting in permanent brain damage, trauma during labor which may result in intracranial hemorrhage, hyperbilirubinemia, it may result from blood incompatibility and cause mental handicapping. Postnatal factors as infection, encephalitis, meningitis, or complication in measles or polio, head trauma, thrombosis of cerebral vessels in severely dehydrated child, malnutrition in infancy may cause permanent brain damage, toxic lead poisoning, which may cause mental handicapping conditions. How can we prevent this condition? We know that we have three levels of prevention: primary, secondary, tertiary prevention. Primary prevention means prevention of occurrence of the disease and directed to the at-risk group. We can prevent mental handicapping condition primarily by orientation of public about the problem, proper environmental sanitation, improving socio-economic status of the community, control of the communicable diseases, correction of the nutritional status of children, proper health education, accident prevention, proper premarital, antenatal, and postnatal care. Uh, Prevention means early case finding and the proper management. Early case finding through um, early examination of the babies at birth and in the beginning of school and during vaccination period in the first 2 years of life. We can examine and put the condition in the chart associated with the children to detect any change in the cognitive function or IQ abnormalities. Uh, Tertiary prevention means prevention of complication. It differs according to the degree of mental handicapping. For morons, rehabilitation can be done through institutional care, which provides special education and training. They can be trained for simple manual work to become socially independent. Imbeciles trained to take care for themselves under supervision. Idiots are in need for hospital care and treatment. Now we will discuss mortality problems rapidly. Mortality means death. We can divide mortality into perinatal mortality. Take care of P-E-R-I means around. Perinatal, that is to say, number of fetal deaths from 28th week of gestation plus number of deaths in the first week of life. It's influenced by prematurity rate in addition to causes of stillbirth as intrauterine infections, obstetrical complications, general diseases, and so on. Infant mortality rate, it is the number of deaths of infants below 1 year per 1,000 live births in a certain locality or country and year. Here I told you infant mortality rate. If I asked you to tell me any type of rate in your curriculum, take care that it must be related to time, place, and there is a magnification number to be easy to deal with the number. It is the number of deaths of infants below 1 year per 1,000 live births in a certain year and locality. What is the importance of infant mortality rate? It is taken an index of the community development in general and an MCH, maternal and child healthcare services in particular. In Egypt, it was more than 165 around 50 years ago, progressively declined to 115 in 1970, 40.5 in 1989, 33.9 per elf live births in 2004, and 25 per 1,000 live births in 2008. It's as low as 10 or less in developed countries. Index significance of infant mortality. Infant mortality is important indicator of the following: state of community and the socio-economic development, especially sanitary condition of the environment, nutritional status of mother and the infant, education, culture, and habits of mother, effectiveness, which include efficiency or efficacy and utilization. What is the meaning of utilization? Utilization means using of the services by the population. Causes of infant mortality, neonatal causes as prematurity, major obstetric injuries, congenital anomalies, asphyxia neonatum, infection as tetanus neonatum, and congenital syphilis. Post-neonatal causes as gastroenteritis and respiratory diseases, congenital anomalies, and prematurity. What are the factors affecting infant mortality? Social factors. The higher the socioeconomic status, the lower the infant mortality rate. Biological factors as age of the mother at conception below 20 years, inter-pregnancy spaces below 18 شهر, parity especially in the first one and the fifth one or more, and multiple pregnancy. Medical conditions during pregnancy, whether general diseases or complications of pregnancy. Preschool children mortality, it is the deaths of preschool children aged 1 to 5 years. It is the total number of children deaths aged 1 to 5 years per 1,000 of children of the same age group in certain year and locality. This is the preschool children mortality rate. In Egypt, this rate is about 23 per 1,000 live births. It is highest during the second year of life, followed by the third year, and lowest during the fourth and the fifth year of life. Causes may be gastroenteritis, pneumonia, accidents, home or outside, congenital heart diseases. Thank you, and I hope it is a useful lecture.